my topic is immediate sequential bilateral vitreoretinal surgery for management of retinopathy of prematurity. ISBBS is defined as vitreoretinal surgery in eyes during the same anesthesia session. So it is an enormous need in the era of more advancement in neonatal care, where more of surviving premature babies coming and more is the incidence of retinopathy of prematurity. Although there is more awareness about the ROP and its sequelae, still there are many ROP cases coming to us in the advanced stage of ROP when it is not manageable with lasers and anti-VEGF alone. So here comes the role of vitrectomy. So why bilateral simultaneous? Because disease is bilateral symmetrical and it is rapidly progressive disease. Delaying the treatment even a week can lead to poor outcome. Babies are sick, premature, risk of anesthesia, but the risk of re-anesthesia for second eye surgery in the short span of time is undesirable. Also, the pediatric VR surgeons are not available everywhere and there are financial challenges also. So a single session surgery for both eyes can address all these issues with good visual outcome. So this is the baby came to us with bilateral symmetrical advanced ROP. So what you will do? If you will operate the one eye in one session, then if the surgery anesthesia team doesn't clear him for other surgery, then the other eye will go blind in that short span of time. So although there are risks like general anesthesia and endophthalmitis, but still the risk of dying with a second anesthesia session is 10 lakh times more than the bilateral endophthalmitis. So our purpose is to study the efficacy, safety, anatomical outcome of bilateral sequential vitreoretinal surgery in advanced ROP. It's a retrospective interventional study conducted in tertiary care center. We include the advanced ROP cases and exclude stage 5B and 5C, electronic medical record system of the hospital to use to procure the data, and follow-up was for 3 months. And after doing EUA and the one eye surgery, the surgeon re-scrub, re-gown, re-glove, and re-prepare the other eye, re-drape the other eye, and the second eye is treated entirely as a second patient. Even the new set of instruments, even the vitrectomy pack is used as a new pack for the other eye. And the 2 sets of post-operative eye drops were given. And the experienced anesthesia team and the OT staff is our backbone. So 55 eyes of 28 babies with birth weight of 1,188 grams with mean gestational age of 30 weeks were included. 16 eyes had stage 4A, 36 eyes had stage B, and 2 eyes had stage 5A. Lens sparing vitrectomy was done in 50 eyes and the lensectomy vitrectomy in 5 eyes. Laser photocoagulation was done in all eyes except stage 5 and preoperative ranibizumab given in 21 eyes. Only 2 babies has anesthesia-related complications. One baby was shifted to neonatal emergency, and because there was inability to maintain the saturation, and the other eye surgery was abandoned. And the one eye had apnea post bilateral surgery, and he was kept under monitoring and recovered. No endophthalmitis was noted in any eye except hypotonic choroidals and loose blood. We achieved the anatomical success in 70% of eyes. This is the preoperative photographs and this is the postoperative anatomical success. Here is the another one. And to conclude, IBSB is the safe, feasible option with definitive advantages under good anesthetic care when the disease is bilateral, symmetrical, rapidly progressive, and the repeat anesthesia is a problem. So well-informed consent mentioning the risk of anesthesia and the bilateral endophthalmitis must be taken to avoid medico-legal consequences. So here's the patient which I have shown you at the beginning of the presentation with a bilateral symmetrical and advanced disease. This is the one-year follow-up of this patient having good anatomical outcome. And here you can see this patient can see. So this is the happy ending for this patient where we operated the patient with bilateral symmetrical disease and he achieved a good anatomical outcome with the timely surgical management. Thank you.
Dr. Manju, you want to ask some question?
Nothing really, well presented, so that's good.
Thank you.
Dr. Abhijit? Ma'am, I have assessed in the previous session.